We saw a need to better support women before and during pregnancy in order to improve their health outcomes and that of the next generation. And not by placing the onus on women as individuals, but by creating evidence-based knowledge and resources to implement change at a healthcare systems as well as societal level to try to help women in this very important stage of life. I'm Professor Helen Skouteris, and I've had the absolute honour of leading the Centre of Research Excellence in Health in Preconception and Pregnancy, CRE HiPP, for the past 4 years. Thanks to the generous funding of the National Health and Medical Research Council and further in-kind support, we're here today to mark the end of CRE HiPP. So please join us as we reflect on some of the highlights this grant has helped achieve.
CRE HiPP support was instrumental for me and my career trajectory. It funded part of my fellowship to advance research in women's health during pregnancy to positively impact women and their families. So across CRE, we were involved in developing the Optimal Me program. So Optimal Me is a unique preconception to pregnancy healthy lifestyle program that follows women across the life course of preconception, pregnancy and post-birth. It was developed in partnership with Medibank Private and delivered to their membership base, and was also supported by MRFF and CRE HiPP. Optimal Me involves engaging women when they boost their private health cover to include pregnancy and birth, which effectively signals their intention to conceive a pregnancy. The aim of the program is to optimise women's health across those life phases and create better outcomes for women and their babies. We're now using the results of the Optimal Me program to inform a wider implementation trial that will be delivered to a broader population of women in the public healthcare system.
CRE HiPP funding supported our pilot work on weight stigma, particularly a women's photo voice study, which was funded through one of the CRE's grant rounds. And this pilot informed a larger national research project called the Radiant Study. And this research together led to the development of national best practice principles for weight stigma in maternity care. Those principles have now been endorsed by professional bodies, including the Australian College of Midwives. This is a really exciting time for our research because it enables us to translate all the work we've been doing to try and make a difference in the care provided to women. I'm extremely privileged to be the co-chair of the HiPP Early and Mid-Career Researcher Collective, which has benefited greatly from CRE support. So the HiPP EMRC are focused on preconception, pregnancy and postpartum health. And early funding from the CRE enabled us to have an in-person meeting in Sydney, which was our inaugural priority setting day, as well as providing us with a website to share our outputs and connect with other like-minded researchers across the globe. And now we have grown to a network of almost 300 early and mid-career researchers, and we now have branches in the UK and North America.
CRE HiPP has been a wonderful vehicle that's given credibility and practical support to preconception health, both in research, but also enabled us to bring together a national preconception health network. And that has been a vehicle that's enabled us to do some priority setting, which has then led to core indicators and identifying gaps in how we can monitor preconception health. And it's been it gave us that credibility and the initiative to do that, as well as some administrative support to achieve that. And we have around 79 members from across Australia now, which has been a really great effort, I think, from a very small but very dedicated group of researchers. We've also had some community members involved, which has been really valuable and something that we really would like to expand in the future. So the other thing that's enabled us to do has been to expand regionally, and we've developed a Western Pacific Preconception Health Network with members currently from Japan, Singapore, Malaysia, Australia and the Pacific. And very excitingly, we have held the first Western Pacific Preconception Health Conference in November in Kuala Lumpur. And we're really hoping that that will galvanise preconception health research and networks in the coming years.
Some of the real highlights of the work that have been done in the CRE HiPP and have evolved over time really relates to consumer co-design and listening so carefully to what it is that women want. I think that this has been actually something that's been really pioneering and an incredible strength of the CRE HiPP. And I think that actually the work that the CRE HiPP has done has probably improved the quality of maternity research much more broadly than just its own work. What's even more reassuring is that the outcomes of this grant, the connections that have been made, the research that has been established and is ongoing, will live well beyond the period of its funding.
So CRE HiPP also provided a fantastic training and mentoring platform for early and mid-career researchers. In fact, we delivered 35 grants worth $240,000 to build capacity in PhDs, clinicians, and early and mid-career researchers, helping springboard their careers.
I was so excited to receiving the PhD support grant because it gave me an opportunity to attend conferences and meet colleagues, which I wouldn't have done if I didn't get that PhD support grant. I was so excited and so grateful, and it actually created a platform for me to practice my speaking, to disseminate my findings, but also to get feedback and get this huge networking opportunity. So I was so excited and so grateful for CRE HiPP.
The alliances formed over the past 4 years has to be one of my proudest achievements of this incredible CRE HiPP program of research. We created a number of alliances in an effort to reframe the maternal obesity prevention narrative to ensure that we are focused on the health issues that matter most to women during preconception and pregnancy, and to create non-stigmatising, non-racist and non-discriminatory solutions. So thank you to all our partners, collaborators, and most importantly to all the CRE HiPP chief investigators, associate investigators, early and mid-career researchers and members for being part of this fabulous vision and journey.